My presentation today keyed on the fact that privatizing public health care services is not just having a neutral effect, it's actually taking away from services for people in northern communities because of the lack of sufficient resources outside of hospitals. So as we cut services in hospitals, people are in more and more precarious position and desperate to find services for themselves. Waiting lists are longer, extra user fees are coming up that shouldn't be there. And so I think it's time that the government said enough is enough, restore funding to where it should be, and make sure communities in the north have the proper services that they expect. The problem that we find is that privatization of public health services is only introducing a profit motive and a profit margin into the limited funds that are available. So the result is increased user fees, and sometimes people are being charged user fees for services that they shouldn't be under the Canada Health Act that should be provided as part of public. So we're paying taxes and then getting charged user fees on top of it because of the profit margins that have to be met. That's a problem, and that's taking away from services. In the case of hospitals and home care, it's forcing the leadership of our hospitals to make very difficult decisions to cut programs because there's just not enough money coming back into the system.
Do you find that the energy costs is part of their decision to try and privatize?
Well, I don't know if it's just the energy costs, but I know certainly across the north, when I travel in the northeast, energy costs are increasingly a problem, putting pressure on all public services, and I would imagine so, particularly so in the hospitals.